Mr. Hyatt, a 68-year-old long-term care resident with a history of depression and alcohol use disorder, has been found by staff to be hiding alcohol in his room. Over the past few weeks, his mood has deteriorated, and he has been increasingly isolated. After a recent fall, staff discovered empty bottles in his room, and it became apparent that he had been drinking excessively. Mr. Hyatt denies having a drinking problem and refuses to discuss the issue with the healthcare team, stating that the alcohol helps him cope with his depression. The healthcare team must balance Mr. Hyatt's autonomy and right to privacy with the responsibility to ensure his safety and well-being, as his drinking poses risks to his physical and mental health. Applying the 4 ethical principles, the issues are the following. Mr. Hyatt has the right to make personal decisions about his behavior, including whether or not to drink alcohol. However, his actions are affecting his health and potentially the safety of others in the facility. The staff has a duty to act in Mr. Hyatt's best interest, which may involve addressing his alcohol use disorder and providing support for his depression to improve his overall well-being. The team must avoid harm, meaning they need to mitigate the risks posed by Mr. Hyatt's drinking binges, which could lead to further falls, worsened depression, or alcohol-related health issues. The team must ensure fairness in how they manage Mr. Hyatt's situation, providing appropriate care and support without unfairly restricting his freedom or privacy. After identifying the ethical issue and how the 4 ethical principles apply, the care team gathers detailed information about Mr. Hyatt's substance use, his medical and mental health history, and any past interventions for his alcohol use disorder. They also consult facility policies on alcohol and review potential legal and safety considerations. The team considers several options, including engaging Mr. Hyatt in a supportive conversation about his mental health and the risks of alcohol, encouraging him to voluntarily seek help. Implementing a harm reduction approach, such as limiting access to alcohol while providing therapy or alternative coping mechanisms for depression. Instituting closer supervision or room checks to reduce the likelihood of hidden drinking, which may violate his privacy but ensure his safety. Involving family members or a mental health professional in a care plan to address both his depression and alcohol use. After a team discussion, the healthcare staff decides to take a patient-centered approach, starting with a non-confrontational conversation with Mr. Hyatt. They also want to include a mental health professional to help him address his depression and alcohol use in a way that respects his autonomy but also ensures his safety. Mr. Hyatt agrees to a discussion, but only if the conversation doesn't address his alcohol use. However, Mr. Hyatt is open to working with the mental health therapist. He begins to meet with the therapist, and the rest of the healthcare team checks in with Mr. Hyatt more often to see how he is doing. With Mr. Hyatt's permission, the team works with the therapist to support activities that may help him cope with his depression without addressing his drinking. The team continues to evaluate Mr. Hyatt's progress in managing his depression. They hope that over time, Mr. Hyatt will feel better and be more willing to address his alcohol use. Regular team meetings ensure that any necessary adjustments to the care plan are made while continuing to prioritize his safety and well-being. If his condition worsens or his drinking leads to more serious risks, the team will re-evaluate the approach, potentially involving more assertive interventions or family members.